This is now cold and flu season, and a lot of people are coming in and getting diagnosed with the itises: bronchitis, pharyngitis, tonsillitis, sinusitis, otitis. With that, the majority of the times, because the symptoms are so severe, my colleagues and I will give antibiotics to destroy every living bacteria in your body. Hopefully, with the destruction of every living bacteria, you also kill off all the nasty bacteria that are causing the infection, and hopefully if the body's healthy, it'll come back right after that and live or return back to wholeness. It would probably be wise after any form of antibiotics that you get a probiotic to re-inhabit and repopulate your colon, your digestive tract, stomach, sinuses, even the mucosa of the vagina. All are important to re-inhabit with good bacteria. If not, the only other things that you'll re-inhabit with are bad bacteria like Clostridium difficile, which is a nasty bacteria to have in your colon after everything's been wiped out. It's called Pseudomembranous colitis, puts you in the hospital. Or yeast infections of the skin, the vagina, the colon, the mouth, the sinuses. So, probiotics, easy. It's an easy investment, and you do it for 1 to 2 months, and it hopefully will repopulate as long as you have a good colon, enough prebiotic in you, and I'll talk about that in due time in another video. But don't forget, the most important thing is to hydrate. Water is really important, especially when you're trying to fight bacteria, whether or not you have antibiotics. I've mentioned antibiotics twice already. That also includes anti-influenzals. There are a couple of medicines that are used to fight influenza A and B. With everybody getting the influenza shot, we're still needing influenza A and B remedies. And they are potent. They don't have too many side effects. But if you have a diagnosis, then you should be taking them. I would always say all these things here will not interact with any antibiotic or any anti-influenzal. So you should give it a try. I have a blog, DrRic Cold and Flu Herbal Go Bag, and I'll put a link here. Look it up. It's the blog is easy to follow. It's just some 7 pointers that you should follow with regards to maximizing your healing potential. And also, I've given a SlideShare lecture. The lecture is from Whole Foods, but I put it on SlideShare. You can review that too. My favorite go-to medicine or supplements during cold and flu season, especially when I get exposed to any kind of influenza, and I am probably about less than 2 feet away from the patients I see that have influenza, strep throat, bronchitis, sinusitis, everything bad. And I haven't taken an antibiotic in about 10 years. I also live a healthy life, so whether it's the healthy living or it's the fact that I rely on my herbals, hey, I don't care. It's not your problem anyway. It's just what I am able to get by with, and I really like to be an example for my patients. This is sinus immunity. It's from Garden of Life. The title is Immune Balanced Sinus. It's from Garden of Life. It has 2 big components that I like in capsule form. Butterbur, which is PA free, and I'm pretty sure I did a lecture or a video on Butterbur. Butterbur is an anti-inflammatory. It's used for headaches. Great results using Butterbur and a couple other things, but I've also found that it helps with sinus infections as well. The inflammation of the sinus swelling, whether it's allergy related or infectious, excellent. The other things that this has are elderberry in capsule form. Elderberry, blackberry, excellent for stimulating white blood cell response. And it's one of the things in Sambucus. Sambucus is what I give my kids, not only my kids, but my patients, as far as if they've been exposed or if they come down with a sniffle or a cough before the fever hits. I use Sambucus usually about 4 times a day in liquid form for kids. This is from New Nature's Way, and it happens to have echinacea in it too for allergy season. And it doesn't taste too bad. You can use this with Tylenol, with antibiotics, with Motrin, with Dimetapp. Immune balanced sinus also has Saccharomyces boulardii, which is a probiotic, as we talked about with the probiotics here, elderberry, and I happen to like astragalus. I think astragalus extract is a very good herb that helps to stimulate immune response as well. All these things are to stimulate immune response. There have been some research studies on other benefits like the inflammation and the headaches, the allergy response, but in combination, as far as go-to, I would usually put this in my bag of goodies to pull out when I'm sick. One preventive, I guess you can call it, that is popular is quercetin. Very well studied, no side effect profile, used beforehand, say during allergy season, because most people that I see say that they had their flare-up of allergies for the usual time period, and the flare-up led to the infection for which they come to see me. I think quercetin's a great antihistamine, and I have a lot of patients that use it as their antibiotic. Quercetin I haven't been able to find by itself, but I see it in combination, especially with vitamin C. Great for pre-season or allergy season, and also good if you cannot find the other things, astragalus, elderberry, butterbur, the elderberry in liquid form. Might want to go with just the quercetin. I would usually average these things 3 to 4 times a day, and then stop after about 5 days. High-dose vitamin C, the Linus Pauling Institute had great studies using high dose almost in the form of 4 grams a day. The worry is that with heavy doses of vitamin C that is water soluble, you might develop a kidney stone. I haven't been able to find any information on kidney stone formation related to high-dose vitamin C. And yet, if you look at some of the research from the Linus Pauling Institute, it does show it's reversed a lot of good disease, or a lot of bad disease and infection without any side effects. I have some herbalists who use olive leaf extract. This comes from the same tree that olive oil comes from, or the same family of plant that olive oil comes from. Very great antioxidant. The herbalists I know use this at high dose to maintain that allergy season regime of herbs that they suggest for their allergy sufferers. Vitamin D I always suggest for the acute inflamed patient and the infected patient, whether it's influenza or bacteria. You can see my lectures or my video lectures on vitamin D, D3 in particular. This is an ultrasonic nebulizer. My herbalist who got me started in supplements and the use of supplements for healing, which is a great book I just picked up, but she turned me on to the use of aromatherapy. Aromatherapy is essentially taking the contents of a plant, squeezing and distilling it into oil, and taking the essence of the oil or blowing it into either aromatherapy or applying it to the skin. I think aromatherapy is excellent with regards to, again, inducing a healing atmosphere in the room, in the office, and also with inhalation. Just for example, eucalyptus, menthol, when you have mucus congestion, it makes most people feel kind of, it opens up the bronchioles, it makes them breathe better. That's what this Olbas is for. I put this next to the Sambucus because these are the two remedies for kids. Sambucus, very well used, very tolerated as far as taste. Olbas oil, it has a little bit of menthol and eucalyptus in it, but it has a few other essential oils that also help stimulate the immune response. Kids usually have snotty noses, and in addition to the moisture in the air, I think you should try to clean out the nose so that they can sleep better. They have less of that postnasal drip that adds to the sore throat problem. This is simply saline. Most kids do not like the neti pot, which I'm a firm believer in. I think neti potting twice a day during regular season is important, and during allergy season as often as you need it. You can't really overdose on neti pots, saline sprays, so go for it. I have a couple people who don't like anything and they just want to cowboy it, or they put their palm underneath the sink in the faucet and they just snort. And you can do that, but it's kind of irritating and depends on how the water is purified in your area. But this is much more gentle. After taking care of cleaning out the nose and irrigating, as you'll see in my other video, eustachian tube dysfunction or stuffy nose, Nasonex is very benign. It's not prescription. You can find this over the counter. It used to be prescription, but it lost its patent, and it is now very useful. You have to apply this after cleaning out the nostrils, and it keeps the nasal passages open, so there's better breathing, there's easier emptying of the sinus cavities, and there's also no postnasal drip to, again, add to the cough or sore throat. Finally, with regards to sore throats, I think mushrooms are an excellent immune stimulant as well. Very good information from Japan regarding the use of their mushrooms, reishi, shiitake, cordyceps. The mushroom is essentially a yeast, but it's a good yeast and has very potent properties. If you can't find it in oral form, I like it in spray form. This is Gaia brand's Throat Shield. You spray it on, and an equivalent of how many units of per spray will give you the load of the yeast or the mushroom. I'm sorry. There's also a company, New Chapter, who makes Throat Shield, and that's also, I used to use that a while ago, but New Chapter was bought out by Procter & Gamble, and there's some political movements on whether they can choose or pick their farms that they would use for their herbs. So until that settles down, I've gone to Gaia, but I'm sure that New Chapter is still going to maintain their independence. Anyway, this is the suggestion of what I have for folks, regardless of whether I put them on antibiotics or not. You can hopefully review everything by just reviewing backwards or looking into my blog or my SlideShare show. But bottom line is, after you get better, you might want to daisy chain into a new lifestyle by maintaining a dairy-free diet, maintaining a low gluten diet, and also maintaining a mostly plant-based whole food diet. If you can do that, then you might not get sick next year, and you might just, or you might just bounce back quicker, not only during cold and flu season, but also during the endeavors of exercise, during any traumatic or times of stress. Life always will throw you stress, and the best and healthiest will come back quickly. The not so healthy folks with high stress and no relaxation response, who don't exercise and are overweight, will probably not come back so quickly. My friends and I can certainly give you a lot of prescriptions. Remember, prescriptions are only for the effects and they don't do anything for the cause. So if you keep on loading up on the effects, you have effects, side effects from the effects, and then you'll still have the problem. So sooner or later you'll have to take care of the true cause, and that usually means living a healthy life. This might be the start of it.